Well, welcome everyone. We are really delighted that you have joined us for a communications webinar as part of the Public Health Communications Collaborative. Just as a reminder to those of you who may not know, the Public Health Communication Collaborative was formed in 2020, just a little while ago, to coordinate and amplify public health messages on COVID-19 and increase Americans' confidence in guidance from local and state public health officials as well as from the CDC. Among the different activities that we are engaged in the Public Health Communications Collaborative, is providing support and assistance to those of you who are on the front lines in local public health, state public health, tribal public health, territorial public health. I know as a former state and local health official just how challenging it can be, particularly in an emergency situation, to answer a range of different complicated questions. And so we're here to offer some assistance from experts in communications that may be helpful for you as you face those kinds of questions and issues on a regular basis. Today, the webinar is also co-hosted with Brian Castrucci. Dr. Castrucci, please wave. Brian is the president and CEO of the de Beaumont Foundation, and he, like I, have worked in local public health and have a sense of what it's like to be on the front lines. Our role will not be the communication experts, but on occasion, during this hour, we may ask a question or ask for some clarification from the experts that we have here who will be providing you with that information. Just a bit of background on the Public Health Communication Collaborative. It has founding organizations, and they include the CDC Foundation, the de Beaumont Foundation, and Trust for America's Health. The partners in the Public Health Communication Collaborative are APHA, ASTHO, the Big City Health Coalition, NACCHO, PATH, and Resolve to Save Lives. And we're very grateful for the partners. The partner organizations don't necessarily endorse all of PHCC content, but they provide us with expertise and assistance in messaging and reaching out to all of you. So I'm now going to turn things over to the experts, the people that we in the Public Health Communications Collaborative are honored to work with. They are leaders in the field of communication. They work for GMMB, which is an expert and very experienced communication firm. And they are Matt James, a senior counselor at GMMB, and Tracy Siegel, who is the senior vice president and managing director at GMMB. And they'll explain to you the format of today's hour. And we hope you find it helpful, and we look forward to working with you in the future and listening to you about what would be helpful in terms of grappling with the many different communication issues that arise. So now, happy to turn things over to you, Matt and Tracy.
Fantastic. Thank you, John. And Patty, if you'd like to just go to the next slide, please. So everyone, we're going to begin today. We're going to spend most of this hour addressing questions that you have, those that have come to us before today's session, and then leaving time as well for any that you may wish to raise on this call. But what we're going to do is we're going to start off with just a few tips that hopefully will help guide you as you are making some of these very important communications decisions around COVID-19 moving forward. Thank you. So we're going to give you seven essentially ways that you can tailor and prepare your messages to be as effective as possible. The first one is that it's really important that any messages that you deliver be targeted. One of the things that we know is that everybody is impacted by this pandemic. Certainly you're talking to the general public, but there are many other groups, smaller groups that you need to address as well. Those may include people with pre-existing conditions, essential workers that don't have as much freedom to make choices like staying home, communities of color that we know have borne a disproportionate burden of COVID-19, and non-English speakers who really need to be able to access information in their own languages. Generally speaking, the level of detail in your messaging should be commensurate with your audience's specific roles and their needs. And you want to be using messages that resonate specifically with individual communities. As a general rule, giving lay people only scientific evidence doesn't work by itself, right? You need to speak to folks in ways that resonate with them personally. One example is that some health departments have found it very useful to segment their messaging and even their websites by audience, right? And so if somebody needs to find information, they can look for their own specific needs and go find it. Another piece in targeting is that, and we do want to ask folks to mute their lines. Another piece on targeting is that one thing we know is that messengers are also critically important. Clearly, you all are really important messengers, but you can't be all places at all times. And so finding messengers that resonate with those individual targeted communities is very important. Second, messages should be clear. Basically, what we mean here is that when people are being asked to do something, whether it's social distancing, wearing a mask, or staying home, they'll be less likely to comply if they don't understand the message. Basically, that means you want to be jargon-free. You want to speak in layman's terms. Not too much, scientific jargon, and you also want to try to avoid acronyms wherever possible. Third is accuracy, right? We want our messages to be accurate. As everybody knows all too well, a simple misstatement, when amplified by the media in particular, can very swiftly undermine public trust and public health. And so we want to be sure that we are as accurate as possible. And one thing that it's important to say is that in this context, messengers should be comfortable saying, I don't know the answer to that, but I'll find it out for you. That is far preferable to making a statement that you're not even sure is backed up or is entirely accurate. Fourth is you want to make your messages compelling. Again, here, so we're going to share just a few notes from research that has been conducted specifically on communications that have worked around COVID-19. One of the things is you want to communicate the benefit of folks' actions to the broader community. One great example is a UCSF study that showed that if 80% of Americans wore masks and socially distanced outside the home, it would actually do more to reduce COVID-19 than a strict lockdown. That kind of a message is compelling, and it tends to drive people to say, all right, I need to do my part. Everyone can mute their lines. Thank you. People are also more likely to follow messages when they believe that other people are complying with them and that other people in the community expect compliance. So those kinds of messages are compelling, and research shows that they're the most effective at helping people comply. So fifth is compassion, right? We know that everybody's dealing with some kind of hardship or disruption, like I said, as a result of this pandemic, and you never know what somebody's individual situation is, whether they've lost a loved one, they're sick themselves, they've lost a job, they're just having a really hard time staying at home, right? Compassion can go a long way, and that's the bottom line here. And we also know that the best advocates don't just state the importance of complying, but they make it clear that they're doing it as well. This is where you see mayors and governors and others that are saying they're leading by example, wearing those masks, and it's important that anybody in any kind of public-facing role do these things. Next is you want to keep your messaging concise. You want people to remember and internalize your guidance, particularly when it is aimed at behavior change. You want to make it easy for people to remember. I'm sure everybody on this call has heard of the phrase click it or ticket when it refers to using a seatbelt. This is actually a campaign that our firm launched in the 80s. And the remarkable part about it is that it actually resulted in widespread behavior change with just 4 words. In 4 words, that phrase was able to convey what people should do and why they should do it, what would happen if they didn't. You're not always going to have a catchy phrase when it comes to COVID, but just emphasizing the point that fewer words, spoken in layman's language, and making things concise help them to be remembered. And then finally, this issue of repetition. Those of us who have been in the realm of COVID-19 messaging now for months and months and months, we're probably all sick of hearing our own guidance and everything that we're putting out in the public. We figure everybody must have it by now. The truth is, repetition is incredibly important. And Patty's going to put up a chart that shows you. So research shows essentially how important it is for folks to hear messages more than one time before it actually sinks in. And Patty, if you can click one more time just to put the rest of that slide there. So 82% of folks need to hear a message at least 3 times, up to 10 times, right, in order for it to be internalized. That has a lot to do with the fact that right now in our world with social media, et cetera, there's just a lot coming at people. And so repetition of your messages is never a bad thing. I want to leave you with a quote. So, Patty, on the next slide. Words cannot wish away this pandemic, but the right words, delivered responsibly, carefully, and professionally, can be one of the most important public health tools to pave the nation's path on this shared journey. And of course, that's from 2 former CDC directors, Rich Besser and Jeffrey Copeland. So again, you have a lot on your plates with this pandemic. Communications should certainly be a part of it, and we are here to help with anything that you may need. So with that, we are actually going to, Patty, if you want to move to the next slide, please. We are going to move into question and answer. And on the next slide, we're just going to outline a few requests that we have of you. First is we'd like everybody to keep their microphones muted. We will begin this part of the webinar by addressing questions that have already been submitted in advance. Huge thank you to everybody who did that. We really appreciate it. We also want to invite you now to submit any questions that you have at this point. The best way to do that is to use the chat function. You're going to send your question to the host, and then those of us who are answering questions will have a chance to see those. I'm certain we won't get to all of them, but we will try to address those that are most common and that we know are going to have the widest relevance. If we do ask you to ask your question, rather than reading it ourselves, we will recognize you by name and ask you to state the question yourself, and then we will answer. So again, we're going to begin with a few questions that were submitted in advance. And so with that, we'll go to the next slide. And I will hand it over to my colleague, Matt James.
Hello, everyone. Thank you all for joining us. And before I jump into this question, one that I'm sure anyone who has children is thinking about quite a bit this year. But first of all, let me thank all of you. We have many people who are on the front lines trying to do what they can do to fight COVID right now. We all appreciate what everyone is doing in the very tough situation that you're in. It's not easy sometimes having to be the no fun police and tell folks information that they don't want to hear. So we recognize how hard your job is and appreciate it. Before I jump into this, and Tracy, thanks, excellent presentation there. I always have sort of 3 C's that I bring to messaging, which is be clear, be concise, and be consistent. And that's what the public is looking for, is clear language, concisely presented, and consistent. If I had a C for repetition, I would figure that in there too, because that's also true. The more you say, you sometimes think you say these messages, but you need to say them over and over again. The time you are really finally bored saying the message is probably the time it's starting to sink in with the public. Let me just add one more sort of communications basic that you should think about. In this era, particularly of Zoom, where you're having to communicate, sometimes not in an office setting, sometimes in a different setting, but an awful lot you need to think about is visual and how you look, how you come across on camera. think about the setting that you're in. Public health professionals, there's been tons of research done on this. Public health professionals, doctors, nurses, et cetera, are some of the most trusted people that we have in America today at conveying information. Despite everything that has been going on, that still remains true. There's almost no there is no profession that is as trusted as public health professionals. So if you can present yourself as in a way that conveys you visually, either with your office or where you are, that you're a public health professional, that actually helps carry that message forward too. Secondly, you're often delivering information, as I said, that is difficult to be delivered. Being warm and engaging is actually a good way to make people take that message in a little bit easier. Sometimes this is not information that they want to hear. So think about your presentation too. And be animated. Many of you have gone through communications training, I'm sure, but those who haven't, you can sometimes feel a little bit silly, but using your hands, gesturing, making sure that you're conveying authority, things like leaning forward into the camera when you're presenting information, those make a big difference. And so some of these basics, which may sound like, you just want to get the information out, but actually how you present the information is as important sometimes as important as what the information is. So how can I safely celebrate Halloween this year? This is one that all of us, I think, are dealing with right now. And to get to Tracy's point, I think what you need to do is, first of all, be very open about the risks that there are to Halloween. So traditional door-to-door trick-or-treating, many other Halloween activities present the risk of spreading COVID-19. The CDC has guidelines for celebrating safely this year, and you can point people to the CDC guidelines. People should also check the guidelines locally, state, territorial, and health guidelines to find out if there are differences in communities that need to be paid attention to. The second most important point is if you're experiencing symptoms of any kinds, you should not be participating in Halloween activities. Back to the first point, there are modified ways of doing Halloween trick-or-treating, such as having candy that is in bags down at the bottom of the driveway that people can pick up, etc. But you need to be paying attention to social distancing, to all of the things that we have been trying to do through this epidemic. And the safest way is to celebrate at home, find a way to do that, and make sure that the kind of mask you're wearing is not necessarily just a Disney mask, but the kind of mask that is going to protect you from COVID. This is actually a good chance to go back and talk about proper mask use and the way you wear a mask. So after you deliver these messages, come back to traditional, repeat it 3 times, or try to get it in at 3 times, but come back to 3 points. Traditional Halloween activities do present risk of COVID-19. Secondly, if you're experiencing symptoms, please stay home and don't participate in Halloween activities. And make sure that you're wearing proper masks and adhering to the proper guidelines as the CDC has laid them out. Tracy?
Thank you, Matt. Okay. So our next question, Patty, if you want to advance, is it safe to vote this November? Of course, this is a question that is coming up from a lot of folks, just sort of general public out there, wondering about this very important event and how they should approach it. As everybody on this call knows, voting is hugely important every year, this year in particular. And so we want to do everything we can to make sure that the messages that we're giving are encouraging people to do so. First of all, when talking with your state elected or election officials, it's important to note every polling place needs to have some basic procedures in place: social distancing, requiring masks, cleaning and disinfecting between voters, and ensuring adequate ventilation at the polling places is important. When it comes to talking with the public about this, you want to underscore how important it is to do your civic duty and participate in our electoral process. You want to also let folks know, depending on where you are, that in many cases, there are a lot of different options for voting. You may be able to vote by mail in your state or by absentee ballot. You may be able to vote early or to vote during non-peak hours. There is actually a great resource available. NACCHO and APHA have teamed up to create something called healthyvoting.org, which allows folks to go to that site, plug in their state, and get very specific guidelines for what the voting capabilities are in their state. And so again, encouraging everyone who has something to do with polling places to follow all the guidelines, encouraging people who do vote to follow those guidelines, wear masks, socially distance in line, bring hand sanitizer, but always underscore the importance of casting that vote. Matt?
On to the next question. Vaccines. This is going to be one of the biggest challenges I think we face, and of the many very difficult challenges we faced in COVID-19. There's a lot of skepticism, as we know, out there already from the public, many parts of the public, about vaccines and the efficacy of vaccines. And the first thing we'll need to communicate about is, can we trust a vaccine that's been developed in less than a year, if indeed we get to the point where we have an effective vaccine within a year? Important to let the public know that there's well-established protocols about how you test a vaccine in order to ensure that it's safe. They include testing sizable numbers of people, representative segment of the population, and careful tracking of the clinical efficacy and the possibility of any unanticipated outcomes. And that it is in the best interests of both the pharmaceutical companies who are developing this and the governments that are involved, the public health officials, to make sure that a vaccine is safe before it is widely distributed. So reassuring the public that when a vaccine is made available, that it has gone through proper research and has been tested properly, that side effects are known, etc., is going to happen. Also, any attempts to rush a vaccine and circumvent basically these steps would be problematic. So that when and if a vaccine does become available, if it's within a year, which we're all hoping it will be, it will have gone through proper procedures. Secondly, how should we be preparing for vaccine distribution when vaccine is available? Reassure the public that it's essential to have careful, thoughtful, and a national plan for vaccine distribution, and that will be developed and by the CDC and by others. The process of vaccinating millions of people is going to be a long and difficult process, and this is not going to happen quickly. But once it is underway, the public health community will be doing its best job to ensure that it happens in as quick a manner as possible. But understand that this is going to be something that will most likely take quite a bit of time. You don't want to give people false hope. You want to let them know that hope is out there, but not necessarily have them expect that this is something that is going to be widely available to them quickly. And special efforts will be made to reach populations who are most at risk of COVID-19. So it's a lot to unpack in it's a very difficult situation and a very difficult topic. There are side topics to this too, obviously. How do you address the anti-vax community, which will also be sending messaging out there? So hopefully we're in a situation where within this year we are talking about vaccine distribution, and that one I think is going to be one of the biggest challenges we face going forward. Tracy?
Thank you, Matt. All right, so moving on to the next question that was submitted in advance, which says, many state and local reopening plans are based on high infection rates from hardest to hit regions, which tend to be home to disproportionate percentages of people of color. If an entire area's ability to reopen is based on this, will it create resentment toward those populations, and how do we message this? For one thing, I'm not sure how many of your communities are giving out that level of specificity with regard to infection rates. If you are, I think it's important to remember one thing, which is if this virus has taught us anything, it is that a surge in cases anywhere is a threat to everyone. This vaccine transcends all kinds of borders, and certainly folks that are within the same general community impact each other's ability to stay safe and healthy. One example, of course, is essential workers. Many essential workers may live in neighborhoods like you're asking about. They don't have the ability to stay home. They're coming in contact with the rest of communities, even if they're all the way across town on a daily basis. And maybe they're living in conditions that make socially distancing more difficult. So again, viewing this holistically through an entire community rather than parsing out, casting blame against any particular one, and underscoring how this is a community issue that everybody is responsible for doing their part to solve is of utmost importance. So with that, we are actually going to go to some of the questions that have been rolling in. I will start with one. I would like to actually recognize Carol Merrily to please ask your question.
Morning. So my name is Carol Morley, and I'm a local health officer in north central Idaho. And we have some of our challenges oftentimes around normal vaccines have to do with our large anti-vax population. So as we're looking to have our COVID vaccine rolling out and distributed into our high-risk populations, just wondering if you have any advice or messaging that we could maybe use for our overall anti-vax population that is already leery of this vaccine as well as others that we give for childhood vaccines.
Sure. Thank you for that question, Carol. Really appreciate that. So, obviously anti-vaxxers do provide some unique challenges with this whole situation. I think one of the things, so we actually do work on this issue, not only on COVID, but in other areas as well. And what we have found works the best is, first of all, not to dedicate really any time or resources to fighting the views of anti-vaxxers. In many cases, they are entrenched. They are not going to change their minds. Your job, of course, is to put out the best and most scientific and most compelling information. That, as we know, may not work with this group. So investing time and energy in trying to push them is often a pointless effort, a fruitless effort. However, we do think it's really important to be active in the places where anti-vaxxers are also active. We know that they have expanded exponentially on social media in just the last couple of years. And so it's very important that public health institutions, public health officials also have a presence, also have a place for folks to go to find information and to counter any misinformation that is out there.
Great. And why don't we have Elaine Auld ask the next question?
Thank you. Good afternoon, everyone. Elaine Auld from Society for Public Health Education in Washington, D.C. It does follow up on this previous comment because in terms of misinformation that may be made available sometimes by quotes, authoritative representatives, be they local officials or others, to what extent do you recommend we repeat that misinformation to counter it? Because I've always learned in our communication business not to repeat the negative and the misinformation. Well, thank you for the advice.
Yeah, Elaine, that's a great question. And you're exactly right. In general, but then I'm going to have to clarify this a little bit. You don't want to repeat misinformation. There's been a lot of studies done that if you put the information out that is misinformation, people tend to not always hear that, and they still take away that what they think is in the fact, and that becomes something, particularly if it's that politically within the group that they're aligned with, resonates to them, and then they actually can have the misinformation get a little bit more cemented into their brains and think it's true. However, and here's the clarification, when there's something that is actually dangerous that is being put forward and that you as a public health official in the community see is taking ground, I do think it's probably your responsibility to do your best to try to refute that. But I think it has to be a bit on a case-by-case basis. This is something that is just a huge communication challenge from when I started in the communications business way too many years ago. because of now what you see with social media. It's very easy for misinformation to take on a life of its own. We've seen that more recently. It's sometimes even hard to know how much that misinformation is gaining power, because if you're not operating in those channels, you just don't actually know that that message is happening. You're all super busy. One of the things I would try to do, though, as best you can, is monitor when you think there's misinformation out there, see what is being said. But then I think you actually have to make a case-by-case decision as to whether, when you talk about the misinformation and refute it, are you amplifying it in some way, or do you have the ability to try to get in front of it and give the public the correct information?
Thank you, Matt. Okay, so next we're going to go to Walter Sue. Walter, would you ask your question?
Well, yes, this is probably the opposite of the anti-vaxxer question, which is, what message do you give to a person who wants to know why he or she is not a priority to receive the vaccine?
So thank you, Walter. That's a great question. And I'm also going to put Brian and John on notice that if you have anything to add to this answer, we would welcome it. But I think, the key here, I think, as you all know, we need to be prepared for a little bit of chaos around this vaccine. It's likely going to require 2 doses. It is going to need to be rolled out in a very strategic way. States haven't made their plans yet because it's a bit, too early, so to speak, at this point, although I know everybody needs to be getting ready. The key here is distributing this vaccine in a way that is strategic and that in a way that that works to help prevent the most cases and protect the most vulnerable. And so a concentric circle strategic approach is going to be necessary to sort of calm that chaos and take care of this as effectively as possible. And let me pause there and see if any of my colleagues would like to jump in.
Well, this is John. I would just relay that we know that there won't be sufficient vaccine initially to vaccinate the entire population. Regardless of the specifics, the production processes just won't allow for there to be suddenly 300 million doses available. And instead, there will be initially relatively small amounts of doses that have to be offered to those where the greatest possibility of assistance would occur. And probably in the beginning, that's going to be healthcare workers and those who are at the absolute greatest risk of serious illness or dying. And so I think talking about why we need a healthcare system that will be able to function and without concern about people in the healthcare field becoming ill and therefore fewer people to care for patients in the hospital, I think is something the public can understand. It's sometimes a little challenging then defining who's at greatest risk, but I think that there are going to be consistent, clear explanations for that, likely starting with, for example, patients who are in skilled nursing facilities where the death rates have been the highest. So I think I'd really go to the rationale for that and the explanation about production taking time and the need to make hard decisions. And it's part of our, I would say also part of the messaging is this is a societal issue and we need to think about it, not simply in terms of personal risk factors, but how do we allow our society to ensure that we're going to maintain our healthcare system and protect those who are most vulnerable first, and just a few months later offer the vaccine to all populations.
Thank you, John. Matt?
Let's go to Christine Myron with her question.
Hi, thanks for the opportunity to ask. I am just really curious to know any suggestions on how to counteract that COVID fatigue that we're all feeling. We don't have any new messaging necessarily, so how can we kind of give it a new package and get people's interest and re-engage them?
Great question, and it's a very difficult one. I did a lot of public education work in the AIDS community years ago, and you hit the same thing with AIDS fatigue before we began to have breakthroughs in terms of drugs and things like this, and it's really hard. The best suggestion I can give you is to try to, in many cases, build off. Halloween is a good example, or Thanksgiving. Build off things that are in people's minds to once again go and sort of reiterate the messages that you need to do. Sports, things of this nature. Try to find new ways to insert yourself into the subject that is happening in the community at large right now, and get those messages out there. You do reach a point, as you know, in dealing with local news sources. They say we've conveyed these messages. There's plenty of that out there, and it gets harder and harder, in effect, to sell that story. So trying to find a way that if there's something that is unique to your community, that is a local event or something that is happening, or it's tied to an ongoing news thing that the media is just going to cover. Another good one will be, for instance, Black Friday, which right after Thanksgiving. And you can only imagine people going to the stores, and it's a chance to talk about masks again and things of that nature. That's the best advice I can give you, is try to look for different opportunities to take the same information we're still having to present about protecting yourself, social distancing, masks, all the rest of this, and find a way to tie it as best you can into a new package that is tied to the calendar and where the community's head's already at.
Great. Thank you, Matt. I'd like to go to Leanne Stevens for your question.
Hi, thank you so much. I actually have sent two, and so I'm not sure if you have which one.
You bet. I was actually referring to your question on morale within public health agencies.
Perfect.
Well, we can give you a twofer if you want, Leanne.
We can, sure.
Touched on one, but thank you so much again for taking my question. I was hoping that you may have some recommendations for internal communication to build morale and resiliency among public health staff who have been, no doubt, across the country working long and hard hours for months on end. And at least I can speak for our own agency. They have really been at the receiving end of a lot of hate and frustration by members of the public. So we welcome any insight you have in that regard.
Thank you, Leanne. I'm actually really glad you asked that question. This is one of the things that the PHCC has been focused on. And Patty, if you want to scroll back up in our PowerPoint, I want to show everybody a couple of advertisements that the CDC Foundation and all the founding partners have put together and that ran in the last couple of weeks, both in the Atlanta Journal-Constitution, aimed at staff of the CDC, and then also in the Washington Post, aimed at public health officials more broadly. The idea here being a huge thank you and a recognition of what folks are doing and how important that is to keeping the nation safe. And we understand, and I think it's important that you express to your individual staffs that you understand the tremendous amount of pressure that every public health official is under right now. Also the uncertainty. I know that it feels to many folks who have dedicated their lives and their careers to public health work that they may be being undermined, that people aren't trusting them, that there are lots of conflicting messages out there, and it may feel like a thankless job many days. We could just ask everybody to mute. So again, just reinforcing with every opportunity you have how important this work is. And I think it's fair to say that the PHCC is continuing in our role as kind of a group of organizations to reinforce this message and to make it, put it out there as much as possible. Matt, Brian, John, anything to add?
Well, I'll dive in. We've actually gotten good feedback on this ad. This was very specific to 2Market, so I'd encourage you to think about who are your influencers in your community who would be willing to kind of, make this kind of stand. Are there micro influencers on Twitter who are, again, unique to your community, who could say, listen, here's who they are, here are some of our public health heroes. But also, try to craft the stories. It breaks my heart that public health is so rarely mentioned amongst the physicians, the grocery store clerks, the teachers, and we're just forgotten. And we have to work harder to tell those stories and to help people understand what we're doing. And so doing this kind of ad in a local market might help, but getting some of those micro influencers and local influencers to stand up and really speak for public health, I think is really critical right now.
Thank you, Brian. Matt, I'll hand it to you for the next question.
How about let's go to Grace Kelly McGovern.
Grace, if you're speaking, you're on mute. Matt, maybe you just want to read out her question?
Okay, let's do that. Let me find it here. I got it. Grace was asking whether there are suggestions for getting people to talk to contact tracers. Very great question, really. The contact tracing is so important, and it's really difficult to convince many people that this is in their best interest to do this. I think the best way to do it is to have them understand that all information with contact tracers is to remain basically with them. Their anonymity will be protected, and that this is a part of protecting, going back to what Tracy said earlier, to protecting the community, and that basically the entire community, their friends, their family, will be much healthier if they talk to contact tracers and give them appropriate information. It's also important to have people who are doing the communications in certain communities. If you can find somebody that speaks well in that community, so that they will be more comfortable. If you're in a Latinx community, for instance, and you are not Latinx yourself, but you have somebody who can communicate that message, that's helpful also, because there is a lot of mistrust, obviously, about speaking with contact tracers, but it's critical. People have also asked, a number of people have asked whether there's a recording that is going to be made available of this. There is. So we can tell you through PHCC how to obtain that at the end of this call. Tracy?
Thank you, Matt. I'd like to recognize Ryan Easterling to ask your question. And Ryan, you may just need to unmute yourself.
Hey there, sorry, I hit the wrong button. Yeah, I'm in Alabama. I'm at Alabama Public Health, and we're working to develop resources for the vaccine. We want to get the messaging out ahead of time, but we're not seeing a lot of samples. I was wondering if anybody's seen any online that might be good examples to go by.
So that's a great question. I do want to note, of course, the CDC will be putting out guidance on, fairly soon and on a consistent basis. PHCC is also, as you may know, taking general messaging that may be pretty detail oriented and kind of distilling it and making it available on the PHCC website. We're constantly updating that Q&A, and we send a newsletter out about every 2 weeks, alerting you to new questions that have been answered. So please use PHCC as a resource, but the CDC continues to be that primary resource. We do anticipate that guidance will be forthcoming. Brian, John, I'm not sure if you have any insights into timing on that. If so, please let us know. Thank you. All right, Matt, I'll go to you.
Great. Let's go to Arthur Chen.
Hi, thank you for taking my question. I actually, the more important question was that we're in a Black Lives Matter moment right now in our country, and so the question is, how do you communicate reaching out to the communities of color who are at high risk and vulnerable, and in this setting of trying to avoid racial polarization as well?
It's a great question, and I think an absolutely critical one. As we know, communities of color have been highly disproportionately affected by COVID. And there's an obvious reason that there could be a lot of mistrust of health among communities of color, particularly African American communities. I think one of the keys, and I know a number of foundations are looking into this, is to work with community-based organizations in those areas, and this is happening in the Bay Area where I live, to equip them with both the resources and the information that they need, and develop credible spokespeople to be able to communicate into communities of color. This is going to be one of the really hard ones that I think we have to wrestle to the ground, and hopefully there will be resources that will be made available to do this. I think authentic spokespeople who actually understand how to communicate into those communities are important. This also happened in Detroit, where we worked in the early part of the pandemic to communicate messages into Flint, Saginaw, and Detroit. But if you don't have the community buy-in with the right sets of organizations, I think this is just inherently difficult. And it's something we just all really need to focus on as the pandemic moves forward. Brian, John, anything to add there? Okay, Tracy?
Thank you, Matt. I would actually like to go to Adrian Ammerman. I think, Adrian, your question may be best posed to John and Brian, but I'd love for you to ask it. So please, the floor is yours.
Great, thank you. Hi, everyone. This is Adrian with WNC Health Network in Western North Carolina. I help convene a regional communications collaborative here in our region. And so I'm really excited to see that we have now have a national health communications collaborative. And I was hoping to hear more just about your overarching goals, what types of support you're planning to provide to local, regional, and state health communicators, and what's the best way for us to give you our input on how we would prioritize the kinds of support we need right now. Thank you.
Well, first of all, it's wonderful news that you have this communication collaborative in the state, and we would love to work closely with you. So after this webinar, let's exchange emails and have a more detailed discussion. Let me also relay that to the rest of you. If you're involved in other kinds of communication collaboratives where a partnership makes sense, we want to hear from you. You can reach us at Trust for America's Health, and we can schedule time for those kinds of discussions. The goal of the Public Health Communication Collaborative, as you've heard, is to support and elevate the voice and value of public health on the one hand, and on the other hand, to provide support to people on the front lines. Our website is a key to providing resources to those of you who are on the front lines. So getting onto that website, you will see lots of resource materials, not just from the Public Health Communication Collaborative, but from those partner organizations that I'd mentioned, ASLO, NACCHO, Big City Health Coalition, APHA. We're making those readily available in a single location. We're looking for good articles and good examples where people have answered difficult questions. And as you may have heard, almost every week we're adding new answers to tough questions. And we like hearing from you. What are those key questions? We're fielding some of those today with the help of Tracy and Matt. But if there are additional questions people have, we'll put more time and thought into crafting what the wordings might be that you could use in an interview, for instance, or in talking to a policy maker in your community. So we hope those are helpful. Please do check out what we've done so far. And if there are things that we can do that would be helpful for you, we do want to hear from you. Please contact us so that we can respond and provide the kind of assistance that would be best.
So let me just add to that. I hope today's a first date and the start of a long relationship. We're doing this, both John and I, come out of public health practice, and it was bothersome to watch Dan Diamond in his reporting right after the BLM protests kind of throw public health under the bus a little bit and say, look, you're being disingenuous. And I thought, wow, this is a really hard message, right? How do you get this messaging of how do you get, how do you get messages to different kinds of protesters? What's right? What's wrong? This is getting really complex. And I don't think the public health community should be isolated. We shouldn't all be producing our own messages for something that is a universal event. And so hopefully PHCC is going to help bring the voice of 3,000 health departments together, bring more unanimity, bring strength to it so that you're not alone. And I think we all know that we don't necessarily have the depth in the comms departments that we'd like to have. And so how can we kind of work together to get messages out? But this, this is such a time of egalitarian media. You don't need to be doing New York Times editorials to get your message out. There's Facebook, there's Twitter, there's all these different sources that we have to engage with and use. And I hope PHCC will, take, this is phenomenal feedback that just the questions alone today. We will go back. We're only 2 months old. If we were an infant, we couldn't even hold our head up. So we're still learning, right? We're still learning, and we need to think about this. But what ideally we want to get to are messages, graphics, tools that you can immediately implement. So please keep asking your questions. Send anything and everything, as trivial as you may think it might be. Send that to info@publichealthcollaborative.org, and it can, feed a greater conversation, or we can even get right back to you individually.
Great. Thanks for that, Brian. A couple of things. One is the ad copy that we showed you here can be made available for use in local communities to get local agencies to help get that placed. If you notice in both ads, when one used the Atlanta Chamber of Commerce and the Business Roundtable in the other, I think that's actually an important endorser. Public health officials are important communicators, but locally, when the business community gets behind this and says that they are seeing this of value, and that makes those messages that much more valuable. So if that's helpful, we can make that available. And perhaps in your local communities, you can find the endorsers that will ring true there. I also want to go back to another part of Arthur Chen's question, which is how do we communicate to the public that the Black, Indigenous, and people of color community in many cases are likely to get vaccines before other parts of the community get the vaccine. Another great question, Arthur. I think what we have to do is be able to communicate, and you have to communicate as public health officials, that this is one of, first of all, that they're the most disproportionately affected, but this is also one of the ways we're going to get the pandemic under control, is going where the pandemic is at its worst and making sure that we are providing vaccines into that community. Tracy?
Great. Thank you, Matt. I'd actually like to recognize Amy Faust for your question. Amy, you may be on mute.
Can you hear me now?
Yes. Perfect.
About how do we create messaging that can appeal to the populations who may see COVID-19 prevention efforts as affiliated with a political party?
You bet. Great question. I think this is one area in which that message repetition that we talked about earlier being so important. Folks may be trying to dissect communities, to tear apart communities, whether along political lines, racial lines, lines of age, geography, etc. But the fact is that this is a pandemic that impacts everyone. It does not care what political party anyone is. It is an equal opportunity infector, as they say, and it's very important that all of our communications underscore that and make that very clear to folks that think that somehow this is something that's been invented by one side, or they should approach this with politics in mind. Folks need to understand this is a public health crisis, and the science and the public health guidance absolutely needs to guide everything with regard to this pandemic. I think we have time for one more question, which Matt, I will hand to you, and then we'll hand it to Brian to close us.
Well, I was actually going to go straight to Brian on one part of this, Tracy, because first of all, the Beaumont Foundation did a really interesting poll that showed that Republicans actually we're seeing growing trust in terms of public health officials amongst Republicans. Brian, it'd be helpful, I think, if you talk just a little bit about that and then take us to the close.
Yeah, if you go to www.debeaumont.org/poll, you'll find the information that showed in 2018 about 30% of Republicans thought that local health departments were critical to achieve community health. Now it is over 60%. So I think we are falling into a bit of a trap, allowing mainstream media to convince us that one party is for this virus and one party's not. There's a very small but vocal minority that are the anti-maskers and the COVID hoaxers, but the general, 7 out of every 10 Americans support our local health departments and recognize that mask wearing is important. And so, let's try to make sure that our effort goes to the many and not the few, and not take that bait for those who choose. Again, if we can get 80% of our people wearing masks, we're going to be in good shape. Let's try to focus there and not chase the small but vocal minority. So Matt, you want me to wrap up?
Perfect. Thank you, Brian.
I have 3 minutes to wrap up. Hopefully, everyone on this call will want a second date. You'll engage with the PHCC. You'll help us. Really, we're here to deliver what you need, right? That is the purpose of this. We are trying to bring together all of the needs of the number of various health departments throughout this country. Just as a point, Diamond and Silk, who are loyal Republican or loyal Trump supporters, they're 2 women of color. They are major deliverers of anti-vaccine and COVID vaccine misinformation. They have 1.4 million followers on Twitter. So we have to work together if we're going to combat those who are, just bent on putting out misinformation and not allowing us to get through this pandemic. PHCC is your partner, your friend, the person you call when everything else seems a little too overwhelming. Email us when you're about to go into a committee meeting and you don't really know what to say because you've already heard that 3 of the committee members have decided that mask wearing is not appropriate anymore. Let us help you. We are there to help you. We have wonderful foundations involved with this work, and we've invested resources to get to you, the frontline workers. So, our success and our ability to be impactful is 100% dependent on you all telling us what you need. Today was an amazing first step. I'm sure that Matt and Tracy are already going to break a sweat because I have 1,000 notes that I've taken from just hearing you guys today. So keep that conversation going so we can get you what you need so that we can survive this as best we can, and that people will recognize the importance of governmental public health going forward. Thanks, everybody, for being on the call.
Great. Thank you all.
Thank you, Brian. Thanks, everybody. Have a great day.